Good morning everyone and welcome to Wired Health 2022. It's our 10th annual conference dedicated to mapping the future of healthcare. And today is really all about mapping the future of healthcare. We have many speakers from across the world looking at a range of subjects, everything from personalised medicine to applications of technology to frugal innovation, to really figure out where we're going next.
I think we're at a pivot point in nutrition after decades of this sort of fundamentalist religion into calories and fats being evil, that things are changing.
Why it is that we're always told that we eat too much crappy food and we get no exercise and so we all die of heart disease, that gorillas eat a vegetable-based diet, get lots of exercise, and they still have a huge problem with heart disease.
In 2017, a large survey in the Netherlands concluded that actually menstruation-related symptoms cause a great deal of lost productivity. They estimated 9 days per woman per year.
If you are acutely unwell, there is no better place to be than a hospital bed. But once you're past that immediate stage of illness, home has huge advantages.
So it's the first event that we've done in person for 3 years. Incredibly exciting, incredible energy in the room. We have a test lab upstairs, we're showcasing all kinds of innovations. Through in the room behind me, we're having our startup showcase, lots of really early stage companies that are really driving innovation in healthcare. And of course there's the main stage with some amazing speakers, so it feels great to be back.
It's incredible to get to sort of the vibrancy and excitement of an in-person event where you make those connections, you see the speakers in 3 dimensions.
Just the energy in the room today has been great, and there's been so many people to meet and talk to, and I really like the fact that it's brought so many different people together.
It feels nice to be back and to see people.
It's a totally different vibe, totally different energy to be amongst the people.
To hear the real use cases of the technology and to hear from our customers who are here, that how they're being amazed by this technology is really cool, and how it's actually really impacting patients.
Actually being able to see people's passion about the technology that they're deploying, you can only really get that face to face.
We are living in very challenging times at the moment. The societal disruption does offer an opportunity for uniquely particular and radical action to reshape the ways that we have been doing things before.
In a world where data access is no longer a differentiator, how are you going to compete? How does that world look like?
People who tell us they get 7 hours of sleep perform better on our cognitive tasks that taps into memory and planning.
Data is the fuel. The science and technology can very much be the engine, but it's all about insights that we can measure, both clinical and non-clinical, but user experience will really define the value.
We're really excited that Wired Health was the first event that we're doing in person since the pandemic, and we're delighted to have everyone back here and talking about what the next challenges are. How do we really move healthcare forward?